National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopath and a health expert here at Nationalnutrition.ca. I often get approached by patients, especially in the spring and fall times, about doing cleanses and often specifically about colon cleansing. Now, colon cleansing is something that I do often promote with my patients, and the reason behind that is just because you're having a regular bowel movement doesn't mean that you don't have retained matter in the colon. You know, you can basically have a backlog of 2-3 days worth of matter in there, and you know, it's not always going, just because you're eliminating daily doesn't mean you don't have a backlog of material. And the trouble with a backlog of material in the lower colon is that it ferments and it can produce a lot of what we call toxic fermentation byproducts. And these get absorbed into the bloodstream, they travel through the body, and they're toxins. And what they do is they interfere with the normal physiological processes. So essentially, you know, having toxins produced in your lower colon, they get into the bloodstream, they interfere with normal metabolism. It can cause excessive joint pains, they can cause fatigue, it can cause difficulty with concentration, and your body then has to eliminate these toxins, so it increases the toxic burden on your liver, your kidneys, your skin, and your lungs, which are your 4 major organs of detoxification. So for that reason, I like to ensure that my patients, you know, maintain a fully cleaned out colon. And I know it's a topic that people sometimes struggle to discuss, but you know, any pet owner out there, one of the first things they do, you know, to try and assess their animal's health is they look at the quality of the bowel movement. And again, you know, if things are fermenting in your lower colon, one of the other things you're going to notice about the quality of your bowel movement is the odor. You know, if it's a very odorific bowel movement, that typically means excessive fermentation has occurred or improper digestion of the food. And that typically means toxins are being produced. Additionally, you know, the form of the stool is a good indicator as to, again, how much is backlog there is. The darker the stool is, that tends to mean there's been, you know, some excessive fermentation there. As well, too, if it gets rolled into balls, what we call pellet-like stool, that typically is either a sign of dehydration or that the stool has been in the colon too long, and the peristaltic waves that move the stool out have actually rolled the stool into balls, and that's why you get that pellet-like stool. So all those can be signs that, you know, your colon does have a little bit of a backlog, and you just need to work to make sure that you're emptying out everything appropriately. So some of the ways I'll typically do that with patients is use magnesium, but specifically typically like magnesium oxides or magnesium citrates, some of the lesser absorbable forms. And the reason behind that is that magnesium, when it's poorly absorbed, does act as a mild laxative. I also like to use herbs like the inner bark of the slippery elm tree or Ulmus fulva. And the reason behind that is, although it's a mild laxative, it's what we call a demulcent laxative. So it provides a little bit of form for the body to push against to just help with proper elimination, as well as it provides almost a mucus-like coating to help heal any inflammation that may be present and may be preventing your body from properly moving the stool through you. Because again, the colon is a muscle, and any type of inflamed muscle you don't want to move. So that means you're not going to be eliminating from the colon appropriately. So that's why I find slippery elm is so effective. And then I'll typically use an enzyme that has what we call DPP4 activity. That's dipeptidyl peptidase 4. And what that is it's an enzyme that's capable of breaking down some of the complex proteins such as gluten that are found in cereal grains, as well as it has the enzymatic activity to break down the casein protein in dairy. And these in a lot of people can produce inflammation. Not in everybody, but in a lot of people. And so for that reason, I'll typically recommend it to my patients just to help break down those difficult to digest proteins that may be causing a little bit of excessive fermentation or a little bit of inflammation in the colon. So ensuring regular bowel movements is really important. It's a really good marker for your overall health. And of course, the quality of that bowel movement is also going to indicate the quality of the health of the colon. So, check what you flush. I know it may not be the most appetizing thing in the world, but it's a really good indicator of your overall health, and it's something that I think everybody should discuss with their physician to ensure that they are eliminating appropriately, because if you're not, it can actually lead to a very serious condition called toxic megacolon, whereby excessive fermentation of the stool occurs in the colon. This leads to massive inflammation and can actually lead to systemic infections and, in severe cases, death. So it is a very, very severe condition. And so for that reason, I always, make sure that you maintain your colon health, do some annual colon cleansing, because it's a great way to promote regular colon health. So if you like this video, please check out more of the videos on our channel, subscribe, and if you have any questions or comments, post them below. And always remember, knowledge is health.